Hello my friends and welcome back to the channel. I want to quickly talk about something I've not talked about on the channel before, and that's benzodiazepine addiction and withdrawal. What it feels like in benzodiazepine addiction and the dangers of a withdrawal from benzodiazepines. It's something I'm very fortunately away from for quite a long time now. But there was a period back in my early 40s when I was actually addicted to oxazepam, which is a benzodiazepine called Serax. The trade name is Serax. And it was a nightmare. And those of you who have been involved with benzos and trying to get off them and stay off them, you'll understand what I mean by a nightmare. Benzodiazepines are commonly prescribed, although these days the doctors perhaps are a bit more careful, but unfortunately all of these drugs are easy to get on the black market or online. This is the issue. And another issue with that is obviously that you don't really know what's in those drugs anyway, unless you're getting them from a doctor on prescription. However, I know many people who are really struggling still with benzo addiction. That's why I'm making this video with a bit of advice. Back in the day, when I was a youth, they were known, or the most common benzos were known as mother's little helpers. Because they have many uses, benzos, but probably the main one that you're aware of is the reduction of anxiety, that feeling of not being able to cope, being overwhelmed and anxious, and panic disorders, panic attacks and all that sort of stuff. But they're also prescribed for things like a bad back or bad shoulders and stuff like that, where there's muscle tightness and pain in muscles, and a muscle is seized up, if you like. They're commonly prescribed to release that pain. This is where they can sneak in and someone can become addicted to them. And I'll explain why in a second. And the other main sort of use, well, there's two other uses actually, because they're split up into two groups: hypnotics, and I'm reading this because it's difficult to say, anxiolytics. Now, the hypnotics are prescribed for sleep disorders, and they're things like nitrazepam and mogadon and stuff like that. They're fairly mild and they're used just to sort of send you off to sleep, but also very addictive quite quickly. And the others, the anti-anxiolytics, are stuff like chlorodiaz epoxide, which is Librium, diazepam, which is Valium, lorazepam, which is Ativan. These are all trade names that you'll probably be more familiar with them by. Oxazepam, which I mentioned, which is Serax, and clonazepam, which is quite common, which is Klonopin, which is quite prescribed quite a lot. And the other use for those type of drugs is for stopping seizures. And they're routinely given if you have acute alcohol withdrawal syndrome and you end up in hospital and there's a chance you may have a seizure, or in fact you're having a seizure. Sometimes those drugs, or whichever one they think is suitable for that event, it will either be injected into you or you'll be taking them during your withdrawal. But if you're having a fit, they'll probably be injected into you. And I've experienced that. But the anxiety thing is where most people sort of get hooked into them. The problem with benzodiazepines, and this is why they were called mother's little helpers, is because you use them when you're suffering all this sort of panic disorder and anxiety. You think you're going to be using them in the short term when you prescribe them. The problem is these drugs are so insidious that you can actually become addicted to them within 4 weeks. If you take them regularly for 4 weeks, doctors don't like to prescribe them for more than 2 weeks. The problem is when you feel, it's not even euphoria, it's just relief from the symptoms of your anxiety, and you're taking these things on a day-to-day basis, and you're getting through the day much better, and things become more efficient, and you're sleeping better at night, and you're not having your panic attacks, and you're more relaxed. They work on a part of your brain called GABA, a chemical in your brain called GABA, which is gamma aminobutyric acid, which is a feel-good, one of the main feel-good chemicals, if you like. And what these benzos do is increase that chemical, or the secretion of that chemical. And it relaxes you and it calms all those worries away. And it's not even, like I say, the euphoria feeling. It's a feeling of relief and being able to cope with day-to-day issues which were baffling you before. You become able to do that, which is why they're so seductive. And people get hooked on them very quickly. And when the prescription runs out, they either start to, in my experience, they either start to ask for if the doctor's not vigilant and they're getting repeat prescriptions, they can become addicted very quickly. And then they start, when they can't get them from the doctor, if the doctor is vigilant and stops prescribing them, they go searching for them on the streets or online or through friends, or there's loads of ways you can get these drugs. And they're commonly, and they're common on the streets. But these days you've got to be really careful. They're not laced with stuff like fentanyl and other chemicals that you're not aware of. Very, very dangerous. But if you are addicted to benzodiazepines and you want to come off them, it's a nightmare, because it's very dangerous just to stop taking them. They have a great similarity with acute alcohol addiction, like the DT, delirium tremens, and acute alcohol withdrawal syndrome. I bear a great relationship to coming off benzodiazepines. And I know I was addicted to oxazepam, and coming off them is an absolute nightmare. You can't do it on your own. This is the first thing I have to say to you. It's not sustainable, because the only way you can really come off these things safely, if you've been taking them for any period of time, is to reduce the dosage very gradually. And that will take a doctor, usually, or someone supervising you, to reduce the dosage, not relying on you reducing the dosage or breaking pills up or doing whatever you're doing. Because you'll have a bad day and your anxiety will be high, or you'll feel like shit or whatever, you're not sleeping, and you'll whack the same amount in again. You won't ever get off them. So you need a doctor to help you reduce very, very slowly, depending on the dose you've been taking, because there are very varying doses of all these drugs. But the doctor will know the best way to do that and just lower you down slowly. However, it still won't be pleasant. Many of the symptoms are the same of coming off. But the problem with benzos is the symptoms seem to last longer and longer. I know you can get post-acute withdrawal syndrome. I've made many videos on this channel about it. And I've been addicted to opiates and alcohol. Benzos were the hardest thing to come off. It was a nightmare, because you get all these symptoms rushing in. Dysphoria. The first thing, dysphoria is a horrible thing, and for those who don't know what that means, it means that overwhelming sense of depression and doom and anxiety, and the world's going to end. It's a horrible, looming feeling that comes over you. All you see is black and darkness and horrible agitation and anxiety. You can't keep still. You're shaking. You're twitching. It's an awful feeling, dysphoria. Then you're going to get a lot of the symptoms you get from alcohol withdrawal. You could vomit. You'll get insomnia, sleeplessness, a long period of time of sleeplessness usually, agitation, sweating, as I say, shaking. Seizures are a major issue around coming off benzodiazepines, and that's why you need to reduce really, really slowly, because it's one of those withdrawals, like alcohol, if not managed properly, you can die from it. Particularly if you've been taking large quantities, for a long period of time. You cannot just stop, because it is very, very dangerous. So that, all sorts of other things that you get, like I say, with alcohol. Sometimes people experience hallucinations, delusions, paranoia. It's not a nice place to be. So if you're taking these things in the early stages, please be aware of that. And if you've been taking them for a period of time, more than 2, 3, 4 weeks, see a doctor or talk to someone about it, about stopping, and finding other coping mechanisms, which are natural, if you like. As I say on this channel a lot, look at your diet, look at exercise, look at breathing techniques, look at meditation, relaxation, walking in nature. I know that sounds trite and it's not easy to do, but if you introduce those things slowly, they'll all help your anxiety and help you manage your anxiety. So I hope that's been some use to you. It's a dangerous drug, or they're dangerous drug, benzos, and I speak from experience. So seek help from a doctor if you want to come off. Good luck, carpe diem, seize the day today, make today the day you change your life. Read in the description, and if you want to get more involved in the channel, subscribe and like the videos, please. Thank you. Bye-bye.